I want to touch on it first. Like chewing gum. Is chewing gum bad for you? Normal chewing gum bad for the teeth?
Probably no.
Okay.
Two answers that it can have issues with the temporomandibular joint for those that are already having those problems, or if you're the type of person that's going to be chewing it, 8, 9 extended periods of time throughout the day.
Okay.
Um, the other flip side of that, though, is sugar-free gum. It can do a lot of really cool things for a lot of people. Um, Trident used to have a commercial that said, "If you can't brush, chew." Uh,
Hmm.
the idea is that it's going to help pull food, sugars, things like that from those little nooks and crannies in the teeth. So it kind of like brushing, but it's also going to stimulate salivary flow. So it's going to start bathing, rinsing that. It's going to neutralize acids that are in your diet, which is really where cavities come from.
Mm-hmm.
And then just stimulate salivary flow. So for most people, just if you had a meal, pop a piece of gum in, making sure that it is sugar free.
Yeah.
Sugar gum could do a lot of damage.
Okay.
So that's something I would steer clear of, other than an occasional like snack.
Yeah.
But yeah, for most people, regular gum's gonna be fine.
Okay. And the sugar-free gum, would that be xylitol gum? Probably. That's what I've heard is better for chewing than
Yeah,
sugar.
yeah,
Okay.
you did your homework. That's awesome.
Yeah.
So most sugar-free gums are going to be some sort of sugar alcohol,
Mm-hmm.
like a sorbitol or something along those lines. Xylitol is unique in that there's a number of studies that have been proven that xylitol will actually kill cavity-causing bacteria.
Yeah.
So what they'll do is they'll ingest it thinking that it's a food, but the bacteria can't metabolize that, so they end up dying.
Oh wow.
So xylitol, interesting enough. So it was the way I understand it, was discovered in World War II as a sweetener from birch trees, like the bark
Really?
of a birch tree. Yeah.
What?
Um, and then I don't know, I remember exactly what point in time where we understood the value in dentistry. But so yeah, it's added as a sweetener for gum. I used to do a lot of work with Indian Health Services out in Arizona, and we actually had grants to essentially deliver like these like big vats of gum to pregnant women. And the
Really?
idea was that what we would try to do is essentially starve out the bacteria that cause cavities, because you're not born with that bacteria.
Mm-hmm.
So you're gonna be inoculated or pass it to somebody. Yeah, I don't know, who doesn't like to kiss a baby, you know? So
Yeah.
so the idea is what they would do is to have the pregnant moms chew this so that when they kiss their baby, they would either delay or, yeah, I think it's unrealistic, but prevent the transfer of that bacteria to the
Oh
kid.
wow. Okay.
So yeah, so in any case, so rabbit trailing on that one. Xylitol
No,
is
I love
great.
it.
The only thing I find about xylitol is it's super sweet, which is
Mhm.
great. But if you've ever chewed it, it lasts like a minute and then the flavor is
Yeah.
gone.
Yeah, I chew it. I chew it. I chew it for the benefits, but also like it's a workout because starts to get
It's
hard. It's a
hard,
jaw
yeah.
workout after like a minute. Yeah.
That's the truth. Yeah, so you got to keep popping it. Yeah,
Yeah. And I heard that only 2 grams is like a good dose for a day. Did you
sure.
read anything about that by chance?
It's been a while since I read the studies, but yeah, that sounds about right.
Okay.
And I shouldn't even speculate on this, but I'm kind of wondering, or I have to refresh or look it up. I feel like it might, like, overdosing, and that might cause some like GI issues.
Really? Okay.
Yeah, so um, yeah, I'm gonna do my homework. I'll get back to you on
Okay.
that one.
But interesting. Okay, so if chew gum, choose xylitol gum.
I think a
Best
sugar-free
option.
is fine, but
Okay.
xylitol, yeah, it's been proven to kill some bacteria that cause cavities.
Okay, interesting. Let's move on to toothpaste now. Recommended toothpaste. Any brands particular? I know there's like a lot of whitening toothpaste or cavity prevention. Does that mean anything or is that just marketing?
For the most part, I mean, my answer is going to be pretty simple. As long as you're using a fluoridated toothpaste, I think you're going to be doing fine.
Okay.
Um, I have a preference to one of the major toothpastes. It shouldn't matter. I don't have a disclosure. I don't have a financial agreement with them. I like the taste of Colgate.
Okay.
I like Total. It tastes good. I like the way it looks when I put it on my toothbrush.
Mm-hmm.
My wife hates it. She likes Crest. So we have this tiny
Yeah.
sink. So I got mine. She's got hers. But if it's fluoridated, it's fine.
Okay.
There are some additives that go into it. Like, you don't see this as much anymore on commercials, but if you go down the toothbrush aisle, which you get lost in, some will say like prevent calculus buildup. So
Mm-hmm.
there's an additive, like you said. In that case, it's usually zinc to kind of slow or prevent the buildup of calculus.
Okay.
So my answer to patients is, my professional opinion, as long as it's fluoridated, you're getting the benefit of toothpaste.
Okay. So you want fluoride in the toothpaste?
I would,
Okay.
unless there's a situation like it's a child or we're going to eat it. Um, as a general rule, the answer is yes.
Okay.
There are some exceptions that we would want to consider. With that said, I've worked with a number of hygienists that are particular to a type of toothpaste. Um, I'm not going to come and micromanage that situation if they're saying,
Yeah.
"Hey, this is the best one on the market."
Mm-hmm.
I kind of shrug my shoulders a little bit, but
Yeah.
yeah,
Just brush. Yeah.
brush. So toothpaste, I think people have this weird idea of toothpaste like it's like this magic potion or something like that. It's really a flavoring, a little bit of a detergent, a little bit of a scent, usually mint or
Mm-hmm.
bubblegum, whatever it
Yeah.
is, and fluoride. Those are really the key ingredients. You'd mentioned whitening. That's an extra ingredient. We usually add a little bit of a mild abrasive to it. So you're essentially sanding,
Oh, really?
or
Okay.
they're going to use the word polishing, but
Yeah.
polishing is really just on a minute scale sanding.
Okay.
So if you had like a coffee stain or cola or something dietary, you're essentially chew on your toothpaste.
Yeah.
It's going to feel crunchy. It's kind of sandy.
Mm-hmm.
So what you're doing is you're just taking that sandy and just kind of scraping or
Ah.
polishing away.
Okay.
But yeah, I mean, fluoridated toothpaste.
Yeah. Just basic. Okay. Advantage or disadvantage, electric toothbrush versus normal toothbrush.
I'm gonna sound so wishy-washy in my answers. I use an electric toothbrush because I like the convenience.
Okay.
It runs. One of the biggest benefits is mine runs for 2 minutes. I think the biggest problem most adults have, and probably children too, is when they brush. I saw a study one time. I think it said the average U.S. adult brushes for 30 seconds or less.
Yeah.
And I think most of us would be like, "Nah, it's not me."
Yeah.
But if you were to take yourself with a manual toothbrush, most of us are thinking about, say in the morning, we're thinking about what's going to go on today, all the stuff you got to do, or in the evening, I got to get to bed, or I got this, that, the other thing to do. Somebody proved that it was about 30 seconds. So my electric toothbrush runs for 2 minutes. So unless I manually turn it off, I mean, there's times that I'm halfway through, I'm like, God, this thing's taking forever, you know?
Yeah.
My electric toothbrush also will beep at me periodically, and what it's trying to do is divide my 2 minutes up into four corners. So most of us say we're right-handed, we're going to brush really well on the left side of our mouth because the dominant hand's going to go here, and this is
Mm.
comfortable. Most of us will miss the other side because when you turn the wrist, it's uncomfortable here,
Yeah.
and we're usually thinking about other things, and then the wrist just goes right back over. So
Huh.
for me, my breath's just telling me 30 seconds here, 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 here.
Yeah.
Um, the other advantage I find with electric toothbrushes is particularly if you have somebody that doesn't have the skill set or the hand set. So physically disabled, elderly,
Mm-hmm.
hand issues. So a wider based handle, and you don't have to make those refined movements. So just let the brush work.
Gotcha. I've got the same one that does that. Mine buzzes every, I don't know, probably 30
30
seconds.
seconds, yeah.
Yeah, because
Most people don't know what it's for. Yeah.
Yeah, I know. Yeah, and sometimes I find myself going like way over the 2 minute mark because I'm just like sidetracked. I'm just.
Yeah, it doesn't turn off.
No, it doesn't turn off. I could keep going forever, and that does like the four, like to say that it's done.
Yeah.
And sometimes I'm still going. I'm like, whatever. I'll keep it going.
Overachiever.
Yeah, overachiever, I guess. But is there like a technique? Like I just go tooth to tooth, and then I go under tooth to tooth, then top tooth to tooth. Is that what you do with the electric, or would you more so brush?
I'd say
them?
whatever pattern works for you.
Okay.
I'm a creature of habit, so whether I'm doing a dental exam or brushing my teeth, I just run through the same steps in the same order so I don't forget
Yeah.
or miss something. The only thing I would add to your case, and I'm embarrassed that we didn't talk about it before now, is obviously you want to brush your teeth, but making sure we brush that junction point between the tooth and the gums is just important. So we want to prevent cavities, but gum issues, gingivitis, periodontal disease, which all fall under the umbrella of periodontics. We want to make sure we're keeping that junction point clean too.
Okay.